So, but before starting the typical thoracic vertebra, we should have an understanding about the vertebral column. So, what is a vertebral column? Backbone. Okay, so the whole of this structure is the vertebral column. Okay, whole of this is your vertebral column. So it is also known as spine or spinal column. Okay, so what important structure passes through this vertebral column? Spinal cord. Okay, so spinal cord is a part of your central nervous system. Yes. So now what is the function of vertebral column?
To protect the spine.
To protect the spine, then
Body give attachment.
Yes, maintaining of the posture, and then give attachment to ribs, then like transferring the weight of our body towards the limbs, okay, lower limbs. So it also forms the central axis of our body. Now, how many vertebrae are there in our body? No, 12 are thoracic vertebra. 33 vertebra. One of you have said. So the total vertebral column is divided into how many parts? 5 parts, not 4. Cervical, yes. So we have total 33 number of vertebra. Okay. So the first one is your cervical, then thoracic, then lumbar, sacrum, and coccygeal vertebra. Okay. How many cervical vertebra in our body? 7 cervical vertebra. Thoracic? 12 thoracic vertebra. Lumbar? 5. Sacrum? 5. Coccyx? 4. So in total, in a newborn child, we have 33 total number of vertebra. But as we grow older, some of the vertebra gets fused, such as the sacrum gets fused, the coccyx get fused and forms one bone. So like in older adults, usually the total number of vertebra is 24. Okay. But you remember this thing only, that 33. There are total 33 number of vertebra in our human body. Now coming to spinal nerves. So how many spinal nerves are there in our body? So basically, have you heard of cranial nerves?
Yes.
Cranial nerves originate from cranium, that is our brain. Okay. So similarly, spinal nerves originate from spinal cord. Okay. So usually the spinal nerves are named according to the vertebra. So for cervical vertebra, we have cervical spinal nerves. Then for thoracic vertebra, we have thoracic spinal nerves. Lumbar vertebra, we have lumbar spinal nerves. Sacrum, we have sacrum spinal nerves. And coccygeal, we have coccygeal spinal nerves. Short term of coccyx is written as CO. Okay. So now the pattern of spinal nerves. Okay. First, let us understand what is CNS. So CNS is comprised of two parts. Comprises of two parts. What are they? One is brain and spinal cord. So brain is protected by our skull. It is protected by skull, and spinal cord is protected by the vertebral column. Now from brain we have the cranial nerves, and from spinal cord we have the spinal nerves. And the whole nervous system is divided into central nervous system and peripheral nervous system. Okay. Now the arrangement of this nerve is like that. Suppose this is your cervical vertebra C1, then C2, similarly C3, C4, C5, C6 and C7. C3, C4, C5, C6 and C7. So usually the spinal nerves originate from the upper surface of the vertebra, body of the vertebra. So C1 originate from the upper part of C1 vertebra, C2 originate from upper surface of C2 vertebra, C3 originate from upper surface of C3, similarly C4, C5, C6 and C7. But there is an exception. There is another spinal nerve, that is the 8th cervical spinal nerve, which originates from the lower surface of C7. 8th cervical nerve, 8th cervical spinal nerve, okay, that originate from the lower surface of C7. So in total, how many spinal nerve we got? Cervical spinal nerve we got 8. So for 7 cervical vertebra, we got 8 spinal nerves. 7 cervical vertebra, but 8 spinal nerves, because the first 7 arises from the upper surface of the individual respective vertebra, cervical vertebra, and the 8th one arises from the lower border of the 8th cervical vertebra. Now for the thoracic one, all the spinal nerves originate from the lower surface only. There is no exceptions such as, so we have 12 thoracic spinal nerves for 12 thoracic vertebra, all of them arising from the lower surface. For lumbar also, we have 5 lumbar spinal nerve. For sacrum, we have again 5 sacral spinal nerve. But for coccyx, we have only 1 spinal nerve. So how many spinal nerves are there in our body? 8 plus 12, 20, 25, 30, 31. So 33 vertebra and 31 spinal nerves. Okay. So these are the total number of vertebra: 7 cervical vertebra, 12 thoracic, 5 lumbar, 5 sacral, 4 coccygeal. Now spinal nerves. Okay, so try to understand this line. In thoracic, lumbar and sacral, the number of vertebra corresponds to the number of spinal nerves. What I am saying here, thoracic, lumbar and sacral. For the thoracic, lumbar and sacral, the number of spinal nerves is same as the number of vertebra. Okay, each nerve is lying below the corresponding vertebra. For example, in case of thoracic, all the spinal nerves are coming from the lower surface of the body of the vertebra. Exception is for the cervical vertebra, where there is 8 spinal nerves, 7 coming from above the vertebra, and the 8th one is lying below the last vertebra. And for coccygeal vertebra, we have 1 spinal nerve. Now classification based on motility. So classification based on motility. So what do you mean by mobility? Mobile means movement. So by this term, we need to classify vertebra into mobile vertebra and fixed vertebra. Mobile and fixed vertebra. Now, which vertebra are mobile vertebra? You can do your neck like this, so cervical vertebra is mobile. Then we can twist our upper trunk like this, so our thoracic vertebra is mobile. And we can bend forward as well as can stand upright, so our lumbar vertebra is also mobile. But our sacrum and coccyx are fixed vertebra. These are fixed vertebra. So mobile vertebra, cervical, thoracic and lumbar, fixed are sacrum and coccyx. Now length of vertebra in males is 70 centimeter and in case of females it is 60 centimeter. And in between the vertebra you have intervertebral disc, which are present in the intervertebral spaces. So these discs contribute to 1/5 of the total length of the vertebral column. That means we have around 14 centimeter of intervertebral disc length in case of males and 12 centimeter in case of females. Why? 70 divided by 5 is 14, 60 divided by 5 is 12. So 12 centimeter constitute your intervertebral disc space. You got it? Okay. So now let us understand this thing. Okay, let us get this thing again. See, here the total length is 70 centimeter. So here are the individual vertebrae present. In between the vertebra there are certain spaces. So out of this total 70 centimeter space, 14 centimeter in case of males is contributed by these disc spaces, and the rest 56 centimeter is due to this vertical diameter of this vertebra, individual vertebra. In case of female it is 12 centimeter. Okay. Now due to the difference in the width of the individual vertebra, the whole vertebral column can be divided into 4 pyramids. Okay, 1, 2, 3 and 4 pyramids due to various width of the vertebra. Now what happens? Now what is the function of the vertebral column is that it transfers the weight of the upper part of the body to the lower part, and it bears the whole weight of the body. But in between this space, that is in between the disc space of T4 and T5, here you will see there is a sudden constriction like this. So due to this constriction, there has to be certain kind of compensation, because here it has become a weak area. Okay, it has become a weaker area. So to compensate this, we have ribs in front, ribs and sternum in front. So these are your cervical vertebra. Okay, these are your cervical vertebra. Then comes your thoracic vertebra. So you will see in between, so this is your T1, T2, T3, T4, T5. So in between this T4 and T5, you will see this is compensated in front by the sternum as well as these ribs. Okay. Now curvatures. So there are two types of curvatures that you need to know. One is your primary curvature, another one is your secondary curvature. So when a child is born, its vertebral column is present like this. So here you will see the cervical vertebra. The cervical vertebra, by seeing the posture, you can see it is straight. Okay, it is straight. But what happens in case of thoracic vertebra? It gets bent in front, at the anterior part. It gets a concavity. Okay, this is for your thoracic vertebra. So this is your first curvature. Then comes your lumbar vertebra. So lumbar vertebra also, you will see it is almost straight only. Okay, but in case of then sacrum vertebra, there is another curvature like this. This is your anterior concavity. So these two concavity, they form the primary curvature in case of a baby. Okay, but as the baby grows older, you will study in pediatrics that when a child is born, then up to 2 to 3 years of age, the child attains various developmental milestones. What are these developmental milestones? There are gross changes, gross milestones, fine motor skills, social skill development. These things you will learn in pediatrics. So this gross motor development, in this, the child, like after certain months, tries to hold its neck like this, then it tries to stand and sit in the bed. Then after certain months, it tries to stand on the ground. Then going up the stairs one by one with one foot, then with both the feet. These things, there are certain milestones you need to know. And then there are certain social skill development, such as smiling after looking at strangers, then smiling after looking at mother, father, then other relatives, then come strangers. So these things comes under developmental milestones. We don't need to know this thing. We only need to know about this cervical vertebra. So as the child grows up at 4 to 5 months, the child starts to hold its neck like this. Okay, so what happens? The cervical vertebra gets a anterior convexity like this. Anterior convexity like this. Okay, thoracic is concave as it is. And in the lumbar region, at 18 to 19 months, 12 to 18 months of age, the child starts to stand up like this. Okay, when the child starts to stand up like this, another secondary curvature happens like this. This is for your lumbar vertebra, and your sacrum is as it is. So these two things are your secondary curvatures. Okay, so these primary curvatures are there at the time of birth, and the secondary curvatures, one appears at 4 to 5 months of age, another appears at 12 to 18 months of age. Okay, these are your secondary curvatures. So primary curves, these are present at birth due to the shape of the vertebral bodies, and secondary curves, these are mainly for posture purpose and mainly due to the shape of the intervertebral discs. See, these are your primary curvatures. See, the thoracic vertebra has a concavity at the front, sacrum has a concavity at the front. These are your secondary vertebra, secondary curvatures. Cervical gets a convexity at front, lumbar gets a convexity at front. Thoracic, they got concavity as it is. Now in coronal plane you will see that the thoracic vertebra So what do you mean by sagittal plane and coronal plane? So this is your sagittal plane, dividing the body into right and left halves, and coronal plane is dividing in your body into anterior and posterior segment. Okay, anterior segment and posterior segment, ventral and dorsal part. Okay, so if you divide the body like this, you will see through laterally the thoracic vertebra will have a left curvature, I mean left concavity. So what do you mean by left concavity? It is present somewhat like this. Okay, due to the arch of aorta as well as due to using your right upper limb too much. Okay, due to this two feature, it has a left concavity. All these curvatures together, they provide elasticity to the spine and helps in proper holding the body in a proper straight manner. Now coming to these parts of a typical vertebra. If you see this diagram, you will forget it as the exam will come. So let us draw this diagram one by one and understand the whole structure. First of all, see this vertebra. So in the body, the vertebra is present like this. This is your anterior part, this is your posterior part. Okay, now if I do the vertebra like this, so we will draw the vertebra like this to understand it better. Okay, we will draw the vertebra like this. So first of all comes your body. So this is your body. This is your body. Now at the posterolateral part, you have two bones like this. These are your pedicles. This pedicles becomes continuous at the back with two another vertical bones. These are your lamina. These are your lamina. Body, pedicles, lamina. Now both of these lamina, they get fused together at the back. This is your spinous process. Now at the junction of pedicle and lamina, at the junction of this pedicle, this blue color is pedicle, this violet color is lamina. At the junction of both this, you have another process on either side. This is your transverse process. I am writing it as TP, transverse process. On this side also, you will see transverse process. Okay. Now at the junction of pedicle and another thing, this pedicle and lamina together, both of this form your neural arch. This is your neural arch or vertebral arch. Neural arch or vertebral arch. Now at the junction of this pedicle and lamina, we have two articular processes. This is your superior articular processes that is going in the upward direction. In the downward direction, you have two more articular processes. These are your inferior articular processes present somewhere here on the downward side. So I am drawing it with certain dots. These are your inferior articular processes. And in case of thoracic vertebra, you will see on the lateral surface of this body, you will have two facets. These are your costal facets because costal ribs attaches at the costal facets of your thoracic vertebra. And at the transverse process, you will see another facet for the tubercle of the rib. Okay. Now let us see that diagram. See, here is your body. This is basically a thoracic vertebra, but the things are same for all types of vertebra. So this is your body. From the body, you are getting two pedicles. And here is your lamina. These are your lamina. This pedicle and lamina together, they form this arch. This is your neural arch or vertebral arch. Now from the junction of this pedicle and lamina, you get one process, that is your transverse process on both sides. And on the posterior side, this lamina gets continuous with one another and form this spinous process. Okay? And on either side of this transverse process, you have facet for tubercle of rib. And on the costal facet, you have facet for costal facets on these facets. So here the head of the rib attaches. Here comes the attachment for the head of the rib. Here comes the attachment for the tubercle of the rib. So basically the transverse process is made up of one costal element, another one is transverse element. Ideally these are same thing in case of all the vertebra, but in case of thoracic vertebra these things are different. Okay. Now see here, here you will see that the pedicle and the vertebra, body of the vertebra. See, this is basically the body of vertebra. What I was drawing till now was, so the vertebra is present in our body like this. I was drawing the vertebra like this the whole time. Now you consider the vertebra like this, okay, or like this, okay. Now if you consider the vertebra like this, you will see that here is the pedicle and here is the lateral surface of the vertebra. Now the vertical diameter of this body is more than the vertical diameter of this pedicle. Due to this, here in the inferior part you will see one notch. There is a notch, this depression, this is the notch. This is your inferior vertebral notch. And on the superior side also there is a shallow notch, that is your superior vertebral notch. Now what are the function of these notches? So basically, so the spinal nerves that were originating from the spinal cord, they have ventral and dorsal rami, okay, ventral and dorsal branches. Now what happens, this is one vertebra, this is another vertebra. Okay, this is one vertebra, this is another vertebra. Here is your superficial notch, vertebral notch. Here is your inferior vertebral notch. Similarly, in this vertebra also, here is a inferior vertebral notch. Here is a superficial shallow vertebral notch. Now, when both these vertebra attaches with one another, and in between them is your intervertebral disc. So the inferior notch of this upper vertebra and the superficial notch of this lower vertebra together they form one foramen. Okay. Similarly, on the lower side will be, if there is another vertebra, there will be another foramen. Upper side will be another foramen. So here you are seeing the foramen. So this is the foramen basically. This is the foramen. Okay. So through this foramen comes out the ventral and the dorsal branches of your spinal nerve. Okay. Now coming to thoracic vertebra proper. So thoracic vertebra is divided into your typical vertebra and atypical vertebra. Now typical vertebra is from T2 to T8. From the second vertebra to 8th vertebra is your typical thoracic vertebra. So 2 to 8 is your typical thoracic vertebra. And atypical is from 1, 9, 10, 11 and 12. So this atypical thoracic vertebra will be taken care of in the subsequent classes. Today we will be studying only the typical vertebra. So the typical vertebra, as the name suggests, it follows the pattern of any typical vertebra. Any vertebra, it will follow the same pattern only. And what is the speciality of this thoracic vertebra is that the thoracic vertebra, the body is of the shape of a heart. Okay, it has the shape of a heart. So basically the body is like this only. So this forms almost like the shape of a heart. And in case of lumbar vertebra, you will see that the body is like a kidney shape, like this. This is the body of your lumbar vertebra. So this is the body of your thoracic vertebra. Similarly, there are certain differences in case of your cervical vertebra. So this is one part. Second part is that your thoracic vertebra has costal facets. So these costal facets are present on either side. And another process I have mentioned in the diagram, that is your superior articular processes. See, these superior articular processes, This one was coming from the junction of your pedicle and lamina. Another one was coming from the below, just from the lower part of the lamina only, not pedicle and lamina. Here the superior articular process is coming from the junction of pedicle and lamina, but the inferior articular process is coming from the lamina only. What are the features of this articular process is that both these articular processes has facets for articulating with the vertebra above it. See, these are your superior articular processes, inferior articular processes. Similarly, this one also has your superior articular processes and inferior articular processes. So both these vertebra gets attaches like this. So the inferior articular process of the vertebra above gets articulated with the superior articular process of the vertebra lower to it. Okay. So thoracic vertebra identified by the presence of costal facets. Costal facets may be 2 or only 1 on each side, depending on typical and atypical vertebra. Same thing only. There are certain differences, such as at the tubercle of the thoracic vertebra, you will see costal facets for attachment of the articulation of the ribs, and for articulation of the tubercle of the rib. And here we will articulate your head of the rib. Now, at the superior articular facet of the, for the costal facet, these will articulate with the corresponding rib only. Such as this is your 5th thoracic vertebra. So here will come the articulation of the head of the 5th rib only. Okay, but this lower part is for articulation with the 6th rib. And why these are called demifacet? Because see, this lower part is having articulation for the 6th rib. So when the 6th thoracic vertebra will be coming, the 6th thoracic vertebra will also have a superior articular facet, costal facet. And this superior articular facet like this will be forming a complete facet with the inferior articular facet like this. So together they will articulate with the 6th thoracic vertebra, 6th rib. Okay, head of the 6th rib. Similarly, here is also a demifacet. So it will form a complete facet with the inferior articular costal facet of the 4th rib. So together they will form a complete facet like this, and the 4th rib will attach here. Okay, head of the 4th rib, and the tubercle of the 4th rib will be attaching here. And the transverse process, here we will see the transverse process are more thick and straight laterally, present laterally. And the spinous process you will see almost vertically downwards. Let us see here. See, this is your cervical vertebra spinous process. These are your spinous processes of cervical vertebra. But as we goes towards the thoracic vertebra, see the spinous processes are placed vertically downwards. These are placed vertically downwards. These are pointed. But here it is placed vertically downwards. So this is the feature of spinous process. And in case of T5 to T9, that is the 4th, after this 5, 6, 7, 8 and 9, the spinous process is more vertically downwards than the other thoracic vertebra. You will see here also in this skeleton. So these are the two features. And the vertebral foramen also is comparatively small and circular. So basically this is your vertebral foramen through which the spinal cord passes. This is your vertebral foramen. This is nothing. This is for the attachment of artificial vertebra. This is no foramen in real bone. So this is the foramen. So through this foramen passes the spinal cord. So this is your vertebral foramen.
What is demifacet?
Demifacet. So basically this is demifacet. This is demifacet, not a complete facet. Okay, so this is the demifacet of your one vertebra. So the another demifacet of another vertebra comes like this. Together they form a complete facet where the head will attach.
So demifacet means half-way.
Half facet, not a complete facet. A facet will be like this for attachment, but how the half one will have an attachment. So this forms a demifacet, and another one from above forms like this, so they together forms a complete facet. Okay, so here what is written, in the upper 6 vertebra, the costal facet are concave, and in the lower 4 vertebra, the costal facet are flats. And in the last 2 vertebra, you will see that there is no costal facet because no ribs attached with the T11 and T12. Now coming to attachments. So this is your vertebral body. This is your vertebral body. So on the anterior surface passes the anterior longitudinal ligament, and through the posterior surface passes your posterior longitudinal ligament. And in the transverse process, you have 4 attachment. One is the lateral costotransverse ligament attachment at the tip, and on the anterior surface you have attachment for inferior costotransverse ligament, and on the inferior surface you have attachment for superior costotransverse ligament. On the posterior surface you have attachment for levator costae muscle, and in between the transverse process you have attachment for intertransverse ligament. See here, intertransverse ligament. And this is your body, vertebral body. Then goes your lamina. So in front of the lamina you have ligamentum flava. Okay, this is one. This is ligamentum flavum. Multiple number of ligamentum flavum are there, so together they form ligamentum flava. Now posteriorly you have the spinous process. In spinous process you have 2 ligaments. One is the supraspinous ligament. Here is the supraspinous ligament, and in between both of the spinous process you have interspinous ligament. And this spinous process also give attachment for certain other things, such as the trapezius muscle. Trapezius muscle have spinous attachments, spinous process attachments. Then your latissimus dorsi muscle also has certain attachments here. Then serratus posterior superior, serratus posterior inferior muscle also has certain kinds of attachments here. Now coming to ossification centers. So there are in total 3 primary ossification center and 5 secondary ossification center. So this is the centrum of your vertebra. This centrum has 1 primary center. Okay, and then the neural arch. Here comes your neural arch formed by the pedicle and lamina. This has 2 primary center, ossification center. Okay, this is known as centrum initially. Okay, this centrum gets fused by 1 year of age, and this 2 neural arch primary center gets fused by almost 5 to 6 years of age. Okay, these are the primary centers. Then comes your secondary centers. So one secondary center will be present on the transverse process, another one on another transverse process, then another one on your spinous process, and 2 on your upper and lower part of your body, upper surface and lower surface of your body. These are your secondary centers. These secondary centers arises at your 15 years of age and gets ossified by 25 years of age. Okay, now coming to, please don't talk. Now coming to certain clinical anatomy part. So first one is your spina bifida. Sometimes use centrum. Ideally at centrum you have seen that there is only 1 primary center. There is only 1 primary center. But in case of certain vertebra you will see there are 2 primary center at the centrum. And sometimes this is not spina bifida, okay? So spina bifida is basically this part, that is your neural arch. So in neural arch, if one of them doesn't fuse with one another, that is your spina bifida. Okay, if this neural arch don't fuse with one another, this is your spina bifida. And this is another condition where the centrum has 2 primary centers, and if one of them don't fuse with another, then they form one hemivertebra. Okay, the other part of the vertebra is not fused, and when this hemivertebra is formed, there is one lateral bending of the whole vertebral column, resulting in scoliosis. Scoliosis you have seen, na? Okay. Now coming to disc prolapse. Now coming to intervertebral disc. Intervertebral disc is present in between 2 vertebra. This intervertebral disc has 2 important structures. One is your annulus fibrosus. And the next one is your nucleus pulposus. Now, up to 20 years of age, up to 20 years of age, there is no problem, okay? So, up to 20 years of age, this annulus fibrosus is strong enough. But after 20 years of age, this annulus fibrosus, it gets weakened. So what happens if there is any kind of strain in the body, or in case of any accident or trauma, or if someone falls from the bed, this annulus fibrosus gets broken. And if this annulus fibrosus gets broken, nothing will happen. Okay. What happens? After some time, this nucleus pulposus gets on space. So this nucleus pulposus goes outwards, like this. Till this, nothing will happen. But what happens, after this nucleus pulposus comes out, it starts on compressing on the spinal nerves. It keeps on compressing on the spinal nerves. Then the problem comes. So the backache starts on developing, and it usually leads to sciatica. Why sciatica? Because this disc prolapse usually happens in L4, L5 vertebra, and in lumbar plexus you have seen that all the lumbar vertebra, lumbar spinal nerves contribute to the formation of your sciatic nerve. Sciatic nerve comes from the contribution of almost all the lumbar vertebra, lumbar spinal nerves. So since the sciatic nerve is also has contribution of L4, L5 spinal nerve, so due to this sciatic nerves gets inflamed, and due to this people with backache people with sciatica gets shooting pain on their lower limbs. Okay, shooting pain on their lower limbs, and they cannot move their legs. When this, and it is like it stays for lifelong. There are certain kinds of exercises, and with certain NSAIDs, non-steroidal anti-inflammatory drugs, such as your ibuprofen, acetaminophen, with these drugs, or aceclofenac, with these drugs, this can be reduced to a optimum level, but it cannot be, the disc cannot be corrected. With MRI, sometimes if the reading is less than 0.5, then the disc space gets reduced to that level that surgery is required. But if it stays above 0.5 level, then surgery is not required. With normal exercise and lifestyle modification also, this can be reduced. So this is your intervertebral disc, and from the intervertebral disc, if the spinal nerves come out, this is your intervertebral disc, and from this intervertebral disc, your nucleus pulposus is coming out from this broken annulus fibrosus and compressing on the spinal nerve coming out of your spinal cord. This is your spinal cord. Okay, so that's all.